See, this is the point. We know when we were looking at Italy that the articles came out that 99% of the numbers we're seeing, that death rate that we're watching spike right there on Euromomo, are attributed to people who have comorbid issues. They were dying of other issues. And when they combed through that information, what they ended up discovering was that 88% of the death cases ended up dying for reasons other than coronavirus. Here it was, on reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one pre-morbidity. You see, they ended up looking at the numbers and saying it's really only 12% of the number we're seeing. So if we're seeing 14,000 or wherever they're at, you really have to just take 12% of that and say this is most likely the actual coronavirus number. Now, if you think I'm exaggerating this, or I'm cherry-picking scientists like Bhakti that prove a point, did you know that even Fauci is coming to this conclusion? That's right. Now, again, did you see this in mainstream news? Because the very same day that Neil Ferguson was downgrading and was admitting that at 20,000 we were, 2,400% off of where we'd be, I guess that Fauci probably knew about it. I imagine he probably got a call. I'm speculating here. There's going to be some bad numbers coming out. Neil must have warned people, if you've been following my model, I'm going to make a serious downgrade. I'm going to guess that's what's happened because Fauci wrote an article that came out that same day. This is, what is it, in the New England Journal of Medicine? That's right. The New England Journal of Medicine, this is your own Anthony Fauci, along with Clifford Lane, ND, and Robert Redfield from the CDC. COVID-19, navigating the uncharted. Look at this statement inside of this article. If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. What? Less than 1%? He goes on to say, this suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%. Remember, Del Bigtree is not telling you this. I am not telling you this. I am not trying to go out of my way. The head of the decision makers here in America, the lead doctor we have, is writing this in an article that came out last week. Again, did you see this on your news channel? Let's get back to that paragraph. This is very important. So it may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, or a pandemic influenza, similar to those in 1957 and 1968 when we did not lock down the nation, rather than a disease similar to SARS or MERS, which is what we were panicked about, which have had case fatality rates of 9 to 10% and 36% respectively. Now remember, SARS, none of these things ended up being anything. They didn't transmit that far, but we didn't lock the country down, which begs the question, why are we locked down now? Isn't that the question we've all been needing to ask? Several weeks ago, I said we all need to demand to know what percentage rate is it? What death rate warrants a quarantine so that we know if we're below that death rate that we can open things back up. Now remember, he's not saying total deaths. This is literally the death rate looks like it may be on track for a seasonal flu. CNN actually reported an article that came out in The Lancet that said something similar, a little bit higher number, but again, everybody is running to backtrack their numbers right now. Coronavirus death rate is lower than previously reported, study says, but it's still deadlier than seasonal flu. Here's the numbers it predicts. Well, this was another article, here's the actual Lancet article. Data from the epicenter of the outbreak in Wuhan have primarily been obtained through hospital surveillance and thus are likely to represent patients with moderate or severe illness, with atypical pneumonia or acute respiratory distress being used to define suspected cases eligible for testing. In these individuals, clinical outcomes are likely to be more severe, so any estimates of the case fatality ratio will be higher. So they go on to say our estimated overall infection fatality ratio for China was 0.66%, with an increasing profile with age. Similarly, estimates of the proportion of infected individuals likely to be hospitalized increased with age up to a maximum of 18.4% in those aged 90 years or older. 0.66%. Those are the percentage rates. Now, by the way, how they come up with those numbers, if you read the article, essentially they took expatriated people from China that were getting off of airplanes, and they looked at how many, they tested all of them and saw how many were asymptomatic, how many had symptoms, and then by that they determined, I believe the number that there was about, they were off between around 19 to 1, some estimate as high as 40 to 1, but it's those sort of exit polls being done with testing off of airplanes that came to the conclusion it could be more like 0.6%. Well, that's under 1%. And this is why I've been asking for the number. Had we known the number, had Fauci said anything under 1%, we believe we don't really have. It's going to be a bad flu season, but we should probably not to destroy our economy any further. We're at 0.6%, but again, because no one in news has ever asked that important question, we don't know where we're at. I ask you, is a 0.6% death rate worthy of locking down the world? And remember, that's high. Fauci said it could be as low as the seasonal flu. I remember when Donald Trump, who we make a lot of fun of for not understanding this, he predicted this would be less than 1%. This is what he said in the Rose Garden 2 weeks ago.
I think we're substantially under 1% because the people that get better are not reporting. So we only know people that go to doctors and go to hospitals, and we're taking that, and we're still a little bit above 1%.
You know how much ridicule he got? He was attacked by mainstream news agencies, daring to say that this was trivial or was under 1%. Now, what I want to get to now is the numbers. What are the numbers? We have Deborah Birx now really saying we are trying to model this. And Fauci at one point said, a model is only as good as what you put into it. And you got to hand it to Dr. Fauci. I mean, I just want to point this out. This guy has made a million different predictions now. Everywhere from millions could die, hundreds of thousands could die, all the way down that this could just be a seasonal flu. It gives you some sense of why he has probably held on to that position as the head of NIAID for as long as he has, because obviously if you make a prediction for every single possible outcome there could be, when it's all over and people want to come after you and be upset with you, then you can say, no, I made that prediction too. Now, let me be perfectly clear, because this is something we weren't going to cover, but there have been, my understanding is that Fauci's guards or whatever has been ramped up because there are people that are making death threats and things like that. I think that's a horrifying outcome. And I think it's really not, should not be called for. We should never be attacking people. These are scientists doing the best job they can. He's covering his bases. He's doing what he can. We have got to be civil. We've got to be rational. That's the only way we get through this. And that's what we're trying to do here in the Highwire. We're trying to be rational. I'm not trying to get anyone in trouble. The president and Fauci and Deborah Birx and even, Neil Ferguson are doing the best they can. Are they most talented at it? Are they looking in the right places? Only time will tell and history will tell. But what we're trying to do here on the Highwire is show you where these numbers must be coming from and where we think you should be looking. And I think we have one of the best scientific investigative teams in the world, because as you've watched throughout the weeks, more and more, all of the science is marching. They're downgrading the numbers to where the Highwire has been from the beginning. So now let's talk about this estimation. They're now saying it could be between 100,000 deaths and 200,000 deaths. You heard Deborah Birx say if we do everything right, it would be between 100,000 and 200,000 deaths, respectively. Now, if we do everything right, I don't think, as I said at the top of the show, that chloroquine or any of the drugs that are in testing right now, are being tested right now, have anything to do with this. But remember, when you say 100 to 200,000 deaths, and you're saying that the peak is coming in the next 2 weeks, that brings some serious questions. And luckily for us, someone asked one of those questions at one of these podium statements. Here's Deborah Birx answering a very important question.
So right now we're at about 4,000 deaths here in the United States. You're suggesting a spike of more than 90,000 deaths over the next few weeks. Do you have a demographic breakdown of the areas that are most at risk and where most of those deaths may occur?
Well, right now, and I think if you ask Chris Murray, he would say he's using the information coming out of New York and New Jersey and applying that to potentially other states having the same outcomes. I just want to say again, this yellow line, and this is all corrected for 100,000 residents. So this is normalized so we can compare apples to apples. This is still Washington State, this yellow. So they've been able to, for a long time of measuring cases, not have a spike. So it's possible, and we're watching very closely to make sure it doesn't have a spike. But that's what the people in Washington State are doing. This is what every community, Washington State early, about 2 weeks before New York or New Jersey. California, a week before New York or New Jersey. Really talked to their communities and decided to mitigate before they started seeing this number of cases. And now we know that that makes a big difference. Early, as Dr. Fauci said, if you wait till you see it, it's too late.
And again, do you have a demographic breakdown, Dr. Birx, of where these deaths may occur?
So there's a demographic breakdown that we've discussed before related to mortality. And it's as we're seeing in New York exactly what we saw in Italy. Very low mortality, not to say that young people under 30 or young people under 40 aren't getting ill. They are, but most of them are recovering. So the profile looks identical to Italy, with increasing mortality with age and pre-existing medical conditions. And so that is holding in the same way.
Remember, and I do not want you to forget this now for the rest of this show, Deborah Birx just said the profile is matching Italy identically, that we are going on the same path. We're watching exactly what we saw in Italy. That's why I showed you the Italy numbers again. Now remember, just to burn it in, this is what we know about Italy, that 99% of the cases had comorbid issues, things that they were likely going to die of anyway, and they just happened to be dying with COVID-19, not from COVID-19. And they're downgraded as they look at the numbers. They say, we've got to really just say that it's about 12%, that 88% of the cases appeared to really just be dying from those comorbid issues. This is massive. It's important. Remember that 99% number. Remember, Deborah said we're matching them identically. Well, that's exactly what the CDC just put out. This is the CDC's preliminary estimates of the prevalence of selected underlying health conditions among patients with coronavirus disease. Okay? This is their conclusion. Among all COVID-19 patients with complete information on underlying condition or risk factors, 184 deaths occurred, 173 deaths of those above the age of 19. 94% were reported among patients with at least one underlying condition, almost identical to what they were saying in Italy. In Italy, it was 99% of cases. The CDC's own look at this is saying 94% of the cases seem to have a comorbid effect. This was discussed in a piece on BBC News that went on to say coronavirus deaths, what we don't know. And in this article, do we have the article? He goes on to say the coronavirus deaths will not be in addition to these, as statistician Professor Sir David Spiegelhalter, an expert in public understanding of risk at the University of Cambridge, explains. Look at this. There will be substantial overlap in these two groups. Many people who die of COVID, the disease caused by coronavirus, would have died anyway within a short period of time. This is exactly why Bhakti was setting off an alarm and sending a letter to Merkel. Very quickly, let's just look at his last line of his discussion in his letter. He said, we know there's a problem. My question, has Germany simply followed this trend of a COVID-19 general suspicion? And is it intended to continue this categorization uncritically as in other countries? How then is a distinction to be made between genuine corona-related deaths and accidental virus presence at the time of death? Remember, the question is, yes, you may have coronavirus. And by the way, if you're in a hospital for your heart condition or anything else, and COVID-19 is running rampant now in those hospitals because that's why people are showing up, odds are if you didn't have it, you could catch it. This is a known factor when fighting any sort of illness like this. But despite the fact, we have a sense that whether or not you have COVID, you're not dying from it, as we know from Italy. And Birx is saying we are seeing the exact same trend here.